Hey there, it's Dan, popping in for a quick second before this week's story. As many of you have likely seen, the Supreme Court on Wednesday upheld Tennessee's ban on gender-affirming care for transgender young people in one of this year's most watched healthcare cases. The 6-3 decision is a win for the 27 states that have outlawed this care for minors, and it's a blow to Americans who fear it could open the door to more restrictions on the ability of transgender people to access care. We dug into the evidence and arguments at the heart of this case last year, and we'll be covering the fallout from this decision and other changes to transgender health under the Trump administration in the coming weeks. If you have questions you want us to answer about the state of healthcare for transgender Americans, please send us a note at info@tradeoffs.org. Now, on with this week's show.
Scientific breakthroughs have brought a once distant dream within reach.
That is President Trump. This is the year before COVID hit, 2019. The president is speaking before Congress. It's his State of the Union address, the big showy speech when U.S. presidents lay out their policy priorities.
My budget will ask Democrats and Republicans to make the needed commitment to eliminate the HIV epidemic in the United States within 10 years.
It's a policy goal that's about as ambitious as you can get for the nation's decades-long response to HIV, the virus that causes AIDS.
We have made incredible strides, incredible. Together we will defeat AIDS in America and beyond.
Trump got what he wanted. Congress started to pour more money into the fight. Even after Trump left office, the U.S. continued to invest hundreds of millions of dollars year after year into research, safety net clinics, and local public health efforts aimed at ending the U.S. HIV epidemic. Now,
the White House unveiled a budget proposal today that would cut billions from non-defense programs across the government.
President Trump is back in the White House with new priorities. This vision is at odds with the aggressive goal he laid out 6 years ago. Today, to understand what Trump's return to office means for maybe the boldest health policy goal of his first term, we look at a key to his plan to end the HIV epidemic, getting more people on drugs that stop infections. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. One recent morning in Tulsa, Oklahoma, Hana Fields climbed into a white van with her tackle box of HIV test kits ready to head out for work. Hana works for a nonprofit called Hope. A few days a week, Hope sends vans across the city and into nearby rural counties to offer HIV tests. The van turns up at nightclubs, community centers, or on request. Hope has a profile on dating apps so people can reach out that way too.
We'll go to people's houses, we'll meet people at parks, people will sneak out of their jobs on their 15-minute breaks. Testing is so important and so heavily stigmatized that we will try to get a hold of communities that need testing kind of by any means necessary.
Hana, who is Hope's outreach manager, has an easygoing manner. She knows when she talks about how to protect yourself from HIV that the conversation can get super personal super fast. She's direct as she talks about sex and drugs, two primary ways the virus is transmitted.
I have been stigmatized, treated like shit in medical systems. I have waited a long time for care that I needed. So now I do my best to be warm to anyone that I come in contact with because I think it's right.
Hana and her coworker head to a local church parking lot.
If somebody wants a Hep C test, we can just use the sure check for HIV since they'll be there.
The two park the van strategically, so it's easy to be seen. People who are homeless come here to use mobile showers and wash their clothes. It's sunny, muggy, and very windy.
It's just like I could say this.
Tape anywhere? I didn't think about the wind.
The pair set up a folding table with free condoms and flyers.
I found the tape. Woo!
Testing for HIV is important for a few reasons. One, the virus can go undetected for years before symptoms emerge. Two, testing also is this kind of perfect opening to talk to people about the medication called PrEP. If taken regularly, PrEP can prevent an HIV infection.
It is really nice to be able to ease into a conversation about PrEP, especially because we live in Oklahoma where a lot of people don't even know what it is or don't know that it would be an option that would potentially work for them.
Getting this drug to as many high-risk people as possible is crucial to stopping the epidemic. Hana tested 3 people for HIV that day in the church parking lot. They all tested negative. With each, she walked through how to get a prescription for PrEP. No one took her up on it. Most people tell Hana no for all kinds of reasons.
Then there's, rides to the clinic, don't feel like they could get on health insurance. People really don't like blood work, so just some small barriers that become huge.
Hope sends these vans to the same places again and again, says Hana, to get the word out on PrEP, of course. Big picture, though, they're just trying to build trust with people who have a hard time trusting anybody.
If you are there enough in a person's life, you will catch them on the day that they're ready to start taking action.
But as much as Hana may want to, she may not be back. Each year, the CDC spends some $1 billion on HIV prevention, but the president has proposed an $800 million cut to those funds. Much of that money goes to places just like Hope for work to stop the spread of HIV among high-risk people with big barriers to care.
Does this administration simply want HIV prevention activities to go away, and by extension, want additional HIV infections throughout America?
That's Jeremiah Johnson, executive director of the advocacy group PrEP for All. He says the proposed change would gut the work.
Because there's simply no explanation of what else this could possibly achieve in terms of the HIV epidemic.
Jeremiah's group promotes broad use of PrEP, which has been a key pillar in Trump's bold initiative to end the HIV epidemic. The existence of PrEP, in fact, is what helped make that bold effort possible in the first place. The drugs were introduced in 2012. They were considered game changers then, a strong new defense against the spread of HIV where existing alternatives, condoms say, or abstaining from sex, might fail.
Scientists call it PrEP. That stands for pre-exposure prophylaxis.
When taken every day, PrEP can reduce the risk of getting HIV from sex by more than 90%.
I think this is a huge milestone. I think that we are in an era now for the first time when we can foresee the end of the AIDS epidemic.
Despite all the hope, PrEP failed to take off. There are many reasons why, including persistent stigma, lack of insurance coverage, and the cost of prescriptions. Brett Giroir got it. He knew all the reasons why so few people used PrEP, but Brett really believed the U.S. could end the HIV epidemic if we went all in on leveraging PrEP. Brett was the Assistant Secretary for Health in Trump's first term. He was one of the people to come up with the initiative and pitch the idea to the president.
We had the technology to prevent with PrEP. If you effectively treat, you can't transmit by sex, period, zero. We didn't have to build the Apollo program. It was just a matter of will. It's not a matter of miracles have to happen. It's a matter of will.
Once Trump endorsed the initiative in 2019, Brett and health officials across the administration got to work. They set a target. Get 50% of people who would benefit from PrEP using it by 2025. But how to do it? They poured money into community clinics to make PrEP more available, and new grants funded studies on how to get more people on PrEP. Brett says they also went hyper-local with outreach. They wanted to do more than put up a billboard or buy a TV ad.
I went down to Miami. We had a Catholic nun helping us, promote PrEP. You got to have the last mile, right? So this was sort of public health 101.
The first grant sought to curb infections where the data showed new HIV diagnoses were most prevalent. Black and Hispanic gay men in the South, transgender women, some rural areas, people who use injection drugs. Hundreds of millions of dollars flooded into HIV hotspots, 57 different places.
You pick jurisdictions that are the highest need and the hardest nuts to crack, and that's what we did.
Oklahoma was one of those spots. Hope in Tulsa gets some of that money. Those vans to test for HIV and promote PrEP, paid for in part by Trump's initiative. The dividend from this investment is the case of Brad Sullivan. Brad, now 53 years old, had put off getting tested for HIV for years. Then several friends had an STI scare, a sexually transmitted infection scare.
You may not know your status, and a lot of times there's a lot of people that are okay with that until, like for me, it was, I need to do this. This is dumb. I need to take control of my own health. There's no reason I shouldn't. It's 2025.
Brad knew just what to do. He'd seen Hope's outreach staff turn up at Tulsa clubs and an LGBT community center where he taught.
You're going in there and you're talking with people that get it.
Brad Sullivan perfectly fits the profile of who the Trump initiative had hoped to reach, someone who is at high risk but is not on PrEP. I asked him, would he have sought out PrEP if Hope did not exist?
It would be, that would be a tough call there. It would lean probably closer to the not doing it, to be quite honest.
He said he'd feel too vulnerable anywhere else to have a conversation about HIV.
You grow up and you live with that fear of rejection from loved ones, from friends, from people you may just be a casual acquaintance with.
That fear is hard to shake, he says, growing up when and where he did, a small Oklahoma town. Brad came out after college.
My name was going through the grapevine quick when certain people in certain circles found out I was gay. So now you're looking at a whole group of people that you spent years with, and some may talk to you, some may not.
That fear is amplified when his health is concerned. He knows his doctor is concerned for his health, yet when he thinks about going to his doctor,
they may choose not to be a provider for you anymore. Now is everyone within that office, talking. I mean, a little paranoia can hit and feeling judged again. Not me as a person, but for who I'm attracted to.
The threat of discrimination, the hurt of rejection, those reasons help explain why HIV outbreaks continue to flare up in these hard-to-reach pockets in our country. The best way policymakers have learned to combat those kinds of concerns is by funding outreach work. So when someone a lot like Brad, for whatever reason, happens to be ready to start PrEP, an organization like Hope is ready for him. As of today, the administration has withheld at least $460 million for state and local HIV prevention grants that had been scheduled to start June 1st. And that is putting Hope funding for its vans up in the air. When we come back, why advocates say Trump's second-term priorities could pose an existential threat to the fight against HIV in America. Welcome back. HIV and AIDS experts say President Trump's agenda to sharply cut federal spending is paralyzing the work to end the HIV epidemic in America, a signature policy of Trump's first term. To understand what this looks like on the ground, we're examining what his second-term policies mean for getting powerful HIV prevention drugs called PrEP out to more people. In the first half of the show, we looked at how the president's moves have harmed outreach, Tradeoffs producer Melanie Evans joins us to talk about what's happening beyond that. Hey, Melanie.
Hi, Dan.
So we know that today about 30% of people who could benefit from PrEP are taking it. That's progress. Back in 2019, it was just 22%. But that's still a far cry from where we need it to be if we're going to stop the HIV epidemic.
That's right, Dan. Public health officials set a target of 50% by this year. So we're a little bit behind where the first Trump administration wanted us to be. To move that number, public health officials say we need two things: good data to direct outreach where it needs to go, and research to identify the most effective outreach strategies.
Okay, but all that requires people and funding, and this year the Trump administration is cutting both.
Exactly. So let's start with how that's affecting data to track the virus's spread. The CDC is the federal agency responsible for monitoring the HIV epidemic.
Right. The CDC collects data on where and how many new HIV infections are happening.
Yes, and the CDC tracks data on the use of PrEP to understand where outreach strategies are holding the line on infections. I should say, Dan, the CDC did track data on PrEP use. Mass layoffs in the last couple of months included the teams that were focused on HIV prevention.
This was part of the sweeping changes in HHS under Robert F. Kennedy Jr., right? Last month, he told Congress his reshuffling would put more focus on chronic disease and do more with less.
At least for now, Dan, HIV prevention offices that lost staff are doing less with less. The CDC said last month it's unable to update the data on PrEP use because of the layoffs. It's a huge blind spot.
If public health were a business, this would be our business intelligence. This would be our data about in which markets we're doing well, in which markets we need to invest more.
That's Patrick Sullivan. He's the principal scientist behind an online dashboard that maps the virus and response efforts at Emory University. The dashboard relies on this CDC data. Patrick's been using it to pinpoint where there are gaps in PrEP use among people who could really benefit.
That makes sense. If public health experts can identify and understand these gaps in who's using PrEP and who's not, they're going to be able to better address whatever disparities there are.
Yes, and the research shows transgender women, Black and Hispanic gay men in the South, and other groups are at higher risk of HIV. Patrick is worried this data, which people have relied on for years, could be compromised or lost.
It is going to be like halfway in a trip across the country and your GPS goes out and you have no map and there are no road signs and it's like maybe you can navigate by the sun and the moon.
The CDC says it's, quote, evaluating plans and capacity to resume this work and has rehired some HIV staff as of mid-June.
Okay, Melanie. So that's how mass layoffs at the CDC have undermined HIV and PrEP tracking. You also said the White House agenda has hit other HIV research.
It has. Trump's HIV initiative poured money into studies of how best to increase PrEP use among those high-risk groups. Several of the studies abruptly lost funding this year when the president issued executive orders to eliminate equity initiatives.
Right. He canceled a lot of health research, which we discussed on an earlier episode this year. For studies on LGBTQ health alone, the administration terminated about $800 million in research.
Right. A lot of the studies have tried to figure out how to get the message that PrEP can save lives out to people who were reluctant to talk to their doctor. For example, one grant tested apps for transgender women. Another looked at whether cognitive behavioral therapy could help Hispanic, gay, and bisexual men.
I mean, this is the kind of work I got to imagine, Melanie, that's key to ending the HIV epidemic.
That's why the initiative invested in the research in the first place, Dan. I will say there is a study from the CDC that looks at results of this investment so far. Researchers found gains in PrEP use across the country, but no extra boost where Trump's initiative targeted funds. The authors said the pandemic may have played a role. I asked the administration about workforce and funding cuts. Health and Human Services told me that HIV and AIDS programs are a high priority and that critical work will continue.
Melanie, all of this is happening while we could see PrEP become unaffordable for some folks. The Supreme Court will soon decide if most insurers must keep covering PrEP at no cost to patients. The drug would become much more expensive if the court rules that insurance companies could start asking people for a copay. And of course, you've got the Republican budget bill working its way through Congress, which could result in millions losing coverage.
Here's the thing, Dan. The timing of all of this upheaval overlaps with the expected release of a new, longer-lasting PrEP called lenacapavir. The FDA is expected to approve it soon.
Right. I've heard about it. I mean, one dose of the drug lasts 6 months. Drugs on the market now must be taken daily or every 2 months.
Yes. HIV experts I talked to are excited about how this new drug could make it easier to eradicate HIV and AIDS. Of course, a new drug will be expensive, but a more convenient drug could mean more consistent use and more people who stay protected. But cuts to PrEP outreach staff and funding would make it that much harder to get the drug to high-risk folks.
Kind of squandering this innovation.
That's what the public health experts tell me. And Dan, one more thing. Lenacapavir is also interesting because it's an example of where the nation's long-term investment in basic science research has paid off. This, too, is an area where the Trump administration's new priorities call for deep cuts.
I'm Wes Sundquist, and I'm chair of the Department of Biochemistry in the Spencer Fox Eccles School of Medicine at the University of Utah.
Some of the scientific advances that made lenacapavir possible started out in Wes's laboratory.
Melanie, I know how much you love science. What did you learn from Wes about this?
Indeed, I do, Dan. Early in his career, Wes set out to understand one of the mysteries of HIV. It's a quirk in the shape of the virus. His lab was asking a very basic, very science-y question at a time when most of the other researchers were studying promising targets to attack HIV. It turns out the discoveries in Wes's lab helped set the stage for the development of lenacapavir by the drug company Gilead.
When people study fundamental things, they make discoveries, and those discoveries inevitably, as a field, lead to advances in medicine, and often in very unexpected ways.
Figuring that out took Wes and his team about 15 years. The whole time, he relied on grants from the National Institutes of Health to pay his salary and hire researchers.
If we hadn't had sort of reliable, steady funding, we just couldn't have done the work.
As I reported this episode, I just kept hearing about the extraordinary investment the U.S. has made to combat HIV and AIDS. Wes's lab, Patrick's research, Hope's outreach. What doctors and public health workers told me is that the administration's sudden and sharp pullback in federal funding could thwart that investment. And it's hard for some folks to wrap their heads around that kind of a retreat.
What is happening right now is something that I don't think anybody ever imagined would actually happen.
John Brooks spent his career combating HIV and AIDS. He retired a few months ago from his job as the chief medical officer for the Division of HIV Prevention at the CDC. He spent more than 2 decades in that division. He remembers the early days of the epidemic.
I'm gay, and you start to hear about this gay plague, this gay disease. It was terrifying. It wasn't just terrifying for gay people, it was terrifying for all Americans, because none of us knew, how is it transmitted? How could I get it? My God, how many people could I have exposed? How many people might have exposed me? It was terrifying.
John said he can recall breakthroughs that began to tilt the fight against the virus in our favor, including PrEP.
Look, I'll be honest, I went through this myself. You hear the best way to not get HIV is to not have sex. And if you're going to have sex, you have to use a condom. You need to reduce your number of partners. I mean, this is really a hard message to operationalize because each of us, as I sometimes like to say, have 2 brains.
PrEP, says John, represented a very effective tool, one that could potentially cut the number of new HIV infections by about 48,000 over 5 years.
It was astonishing, the potency of this simple intervention, which used a medication that had very few side effects.
Preventing an infection can literally be life-changing. It also avoids the cost of treating HIV over a lifetime, some $500,000. John says he fears progress will dead end at a moment when the U.S. is really, really close to ending the HIV epidemic. But now, Dan, outreach funding has been cut, disease tracking halted, funds for research have disappeared. The cumulative effect of President Trump's actions are strangling this effort, so much so that we could start to see HIV rates reverse and start to climb.
Melanie Evans, thank you so much for your reporting on this.
You're welcome, Dan.
I'm Dan Gorenstein. This is Tradeoffs.
If you enjoyed today's episode of Tradeoffs, don't keep it to yourself. Tell someone else about it. Friend, colleague, family member. Better still, leave a rating or a review wherever you subscribe to us. The NPR app, Apple Podcasts, Spotify, wherever. The Tradeoffs team is producers Melanie Evans and Ryan Levy, editor Deborah Franklin, executive director Jessica Silverman, marketing director Catherine Dougal, with help from Kate Seepy, Cedric Wilson, and Colleen Schenk, sound designer Andrew Perella, executive editor Dan Gorenstein, and senior producer Leslie Walker. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Additional thanks to Lindsay Dawson, Amy Killalay, Harold Phillips, Marcus Dillander, James Kublin, and Valerie Howard. Thanks also to all our listeners who helped to support our work, including Alexander Everhart, James Huang, Katie Giebenheim, Karis Myrick, and Shweta Agarwal. Our media partner is Side Effects Public Media, based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Gordon and Betty Moore Foundation, the Sozoze Foundation, Just Trust, West Health, the California Healthcare Foundation, the Foundation for Opioid Response Efforts, and the Leonard Davis Institute at the University of Pennsylvania. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoff staff, advisors, or funders.